Do you want to take a couple deep breaths with me to tune into this?
Sure, let's do it.
All right. So just take a deep breath and out. Hello and welcome to Hearts Wide Open, the men's health podcast. I'm your host, Dennis, and thanks for tuning in again to redefine what it means to be a man together with us. Today, I'll be talking to Michelle. Michelle is a cardiovascular dietitian and heart health expert from Entirely Nourished, and I'm so glad she is here. But before we jump into today's episode, just a reminder on how you can support the podcast. If you're a fan of the show, please do remember to follow our Instagram, stay updated on everything Hearts Wide Open, podcast, events, and everyday content about men's health, and subscribe to our show wherever you listen to podcasts. Leave a review if you like what we do and if you like this episode. Welcome, Michelle. So nice to have you.
Thanks for having me. I'm excited to be here.
You're tuning in from the US, correct?
I am. I'm in New York.
New York.
Yes.
Amazing. Yeah, we got in touch through your assistant, and she mentioned that you are a heart health expert and how important heart health is nowadays, or maybe always was, but now there's more awareness around the topic. Yeah, why is heart health important? And maybe also for our audience, I'm in my early 30s. Like, why is heart health important for me?
Love this question. So, heart disease is the number one killer in men, in women, in any kind of chronic disease state, from kidney disease, liver disease. It's the number one killer globally. But you know what's really crazy? 80 to 90% of it's preventable. And do you know how do we prevent it? By taking action at your age. So the longer you wait to actually address the risk factors that are modifiable, the higher your increased risk is as you age. And we don't want heart disease. We don't want heart attacks, strokes, heart failure. We don't want it to impede quality of life. So we have to understand what it means to take ownership of your heart health at a younger age. And so I really am excited to talk about this topic because I want to empower your audience to know what it means to be heart healthy, to know how to improve their heart health, because it's a silent disease and it starts brewing in our arteries in our 20s, in our 30s, in our 40s. And if we have even genetic susceptibility, people are having strokes and heart attacks in their early 30s. So we must know about this topic and know that we can do something about it. And that's really powerful.
Wow. Yeah, I actually never thought about heart health before I was contacted by you guys. So yeah, this is also a new topic to me. Yeah, what are some of the things that I, as a man in my 30s, can do in order to prevent death from heart disease, or that's the worst case scenario, I guess.
So if I can give you one tip, if you could take one tip away from this episode today, it would be please check your blood pressure. Most people don't even know what your blood pressure is supposed to be. You know, you go to the doctor and maybe you go to the doctor and the doctor may be like, oh, it's normal. What's normal? I want you to know what normal is. We need to target your blood pressure to be 110/70. And it silently it can rise without you knowing. And when that blood pressure rises even to 130/80, it can cause a micro tear in your artery wall that causes plaque to form and really damages our blood vessel and vascular health. So we need to know that number. It's super important that you test it, and you can test it at home. You don't even have to go to the doctor's office. You can get a very good, affordable blood pressure machine, and right when you wake up, check it. If it's high, we need to intervene with nutrition and lifestyle intervention to optimize it.
I actually was struggling with high blood pressure half a year ago. It was like a time where I had a lot of stress in my life. I was going through some stuff. And back then it was like, yeah, I did a check. I did a brain check as well because I had some headaches. Yeah, indeed. So you just mentioned nutrition as well as physical health, was it?
Yeah.
Yeah.
When it
So
comes to
like,
blood pressure.
Yeah, when it comes to blood pressure, and I had a like for me apparently it was more stress related. But so like what are all the factors that feed into a high blood pressure? Like yeah, what kind of lifestyle should we avoid?
Well, I always like looking at what can you do, right?
Hmm.
So when we're looking at blood pressure, think about it. If your body's under stress, your arteries are constricted. If your arteries are constricted, your heart is working harder to pump blood throughout the body, which raises your blood pressure. But stress is one component. So we need to manage stress. And, life is stressful. Life's not going to get easier as we get older. I think it's important for us to understand and create a toolbox to manage our stress. We need to identify when we are stressed and then put a actual management toolbox to be able to pick out from many different things, right? If you're stressed driving to work because it's a lot of traffic and you're going to be late, it's a different stressor than if you heard bad news from a family member or if a boss was toxic to you. There's many different types of stress that can come in our lives, and we need to have a lot of different coping mechanisms to be able to manage it. That's one. But a lot of what we eat is also contributing to high blood pressure. So, for instance, if we go on a very high sodium diet, we're eating a lot of processed foods, a lot of fast foods, and even healthy foods that are advertised out there may be very high in sodium. That can cause constriction in our arteries, which also puts a lot of stress on our heart that can raise blood pressure. But a lot of times we're not eating enough foods that actually open up our arteries and allow for blood pressure to decrease. And those are things that are rich in potassium and magnesium and calcium and nitric oxide. And that's what we need to add. So, are you missing enough of your fiber rich foods like your vegetables and your fruits and your whole grains and your legumes and your healthy fats in the right portion for you for your blood pressure to come down? But also, blood pressure is linked to insulin resistance. It's linked to kidney issues. It's linked to so many different things. And we have to look at the whole picture in order to assess why your blood pressure is high. And so, when we look at any type of diet, especially at your age, I really want to stress those fad diets, those trendy diets are quick fixes that don't yield optimal heart health results. We need to look at a sustainable plan that takes you and make sure that you're getting all of the nutrients that you need for your body and your heart to thrive, not just for the next couple months or year, but really for the next decades of your life so that you can live a long, healthy life with good quality, that you have functional aging. And so if you ever hear of a trend that cuts out a major macronutrient, that's a red flag. We need to avoid those types of diets like the carnivore diet or the ketogenic diet that says, oh, we don't need this macronutrient. Biologically, we need all of the macronutrients because they have important components to our heart health, to our brain health, to our pancreatic health, to our metabolic health. They all matter. And so we need to really be looking at a sustainable approach that really is metric driven. You don't know if you have high cholesterol unless you test it. You can't feel high cholesterol, especially at your age. You can't feel high blood pressure normally if it's borderline elevated. You don't feel high blood sugar levels or high triglyceride levels. But if those things are high and they're not addressed timely, especially if you have a family history of heart disease, it is a storm that can come up and all of a sudden someone has an early heart attack and they don't know why. And so we can prevent that. So I really encourage everyone to take a step back and know your numbers. Even if you feel fine, you should be getting a routine physical by your doctor every single year. And you should know what's a normal cholesterol for you, what's a normal blood pressure for you, what's a normal blood sugar level for you. Because if you have genetics that are against you for heart disease, which 1 out of 4 people do, that have a high LP little a, those levels are much stricter than just the general population. And so we have to recognize all of these factors. And I'll give you one more thing, your gut health. If you just eat whatever you want in your 20s and in your 30s, you build a microbiome that has negative bacteria. And this is one of my favorite research topics. It's called nutribalomics. It essentially means whatever you eat, your gut creates these byproducts. And it either creates these byproducts that are conducive to heart health, they're very positive in that they reduce the tension in your arteries. They help with reducing and supporting healthy cholesterol and blood pressure values, or they do the opposite and they cause plaque to form. They cause your arteries to strain. So what we eat impacts our gut health, which is the source of inflammation in our body. And every chronic disease, what drives it is inflammation. So we have to pay attention to gut health now so that when you're in your 40s, 50s, and 60s, you're not trying to backtrack, trying to figure out what happened. What you eat now will impact your years to come. And you want to do the things you love, right? You want to continue being able to have the hobbies, going out with your friends, enjoying life. You don't want to be sick. My dad said the most important quote for me when I was younger: without your health, you have nothing. And I never really understood that until I saw individuals be like, Michelle, my health has stopped me from living. And so this age that your audience lies, this 25 to 35-year-old population, this is where you can have such a profound impact in your next decades to come.
Yeah. Wow. Yeah, that was a lot of information just now. I was trying to keep up. Wow, yeah, that's really insightful and very important to recap a little bit. So there's three things, right? So nutrition, lifestyle, and physical activity,
Yeah.
right? That is really important. And testing yourself every year.
Yes. And
Get a
even if
blood.
they're high, test it again. Do it
Yeah,
twice a year. Make sure those numbers are good. Because if
yeah.
they're high for too long, that's when things silently brew, and we don't want that.
And you mentioned gut health as well. Is that a separate test that you can do, or like
No,
how
it's
does that
more
work?
of it's within nutrition and physical activity, stress management, sleep quality. All of our lifestyle factors actually improve our gut health or make or have a negative effect, right? So we see individuals who have a sedentary lifestyle, who are not active, they have a poor gut health microbiome versus individuals who are active have a better gut health microbiome. Same with how we nourish our body. It's either going to be a positive or a negative type of gut microbiome. Our stress, a lot of times who people with chronic stress have really bad GI issues, from acid reflux to constipation to diarrhea to you name it. Crohn's disease, we know stress plays a role. So when we're looking at this, well, my research is very primarily focused on the nutrition part. I always look at the whole picture because it's all connected and they all matter and they all influence each other. So the first step, to recap, is know your numbers. Know your blood pressure. You don't need to make a doctor's appointment for that. Get a blood pressure machine and test it. See where that lies. You really want it 120 over 80 or less, or optimally 110 over 70, especially in your age range. That's one. Then book your physical appointment. See where your cholesterol is, see where your blood sugars are, see where your levels are, even as a baseline, and know what your target should be. So if they're high, we can work on it. And we work on it through nutrition that's personalized. We look at it through consistent physical activity. We look at it through sleep, stress management. We look at it through all of those things. But we need to know and we need to be aware. I think you mentioned before, you're like, I never thought about heart disease. Most people don't, unless they had a heart attack or unless they unfortunately saw a family member suffer. And we can eradicate heart disease, the number one killer, if we take early intervention.
Do you have some statistics on how this is with men, or is it like because we've learned throughout the work on this podcast, we learned that men are less likely to go to the doctor early. So another call to action here for all men: do go to the doctor. It's a good thing. But do you have some statistics there?
It's the same. It's the number one killer in men over
Okay.
all cancers combined. And I would say one other thing, one specific risk factor for men that we should talk about is erectile dysfunction. If someone does not have the ability to perform, or so to speak, their blood vessels are not, could be actually, the small vessels could be with a lot of plaque, not allowing for good blood flow. to the private organ. So if that's the case, a lot of people are like, oh, I'm just getting older. I had too much alcohol to drink, or oh, I'm stressed, or they may make an excuse. That's the first sign a lot of times, because men don't go to the doctor, that something else is going on. So we really need to be looking for these different signs and not ignoring it. It's not macho to not go to the doctor. You're not a man for not going to the doctor. You're a man for saying, my health matters, not just for me, but for the people I love and care about. And if you want to be there for those people and enjoy life, you need to prioritize yourself, and you need to prioritize your care, your health as soon as possible. Because your foundation when you're younger really helps to set the stage as we get older, but also a life that's full with good health is the meaning of life, right? You can do the things you love if you're healthy. And I really want to make sure people are taking that proactive approach. You going to the doctor doesn't mean you're sick. You're going to the doctor so you can prevent sickness. And we have to realize that prevention is important for your long-term health. And so we have to get over that. Well, I feel fine. Why would I go to the doctor? People who are sick go to the doctor. Well, if you don't go to the doctor until you're sick, then it's harder to combat these things.
Yeah. Wow. Yeah, well, all the men out there who just listen to this, don't worry, you've made it this far. But if you heard this, then it is your call to action to go make a doctor's appointment now. Really interesting. I love listening to you talk about heart health. I was wondering, how did you actually get into this?
Yeah. I'll try to make this as short as possible. So, I actually went to New York University to become a doctor. I was in the pre-med track, and I was also studying nutrition because I always knew the benefits of preventative medicine. So, I had to make a decision. I always loved medicine. I was always interested in health. I was an EMT growing up. I was always kind of in the health kind of space. I had a lot of uncles who were physicians. And so I was always fascinated about health in general. And then looking back, I mean, my parents always put a very big emphasis on going to the routine doctor and taking care of your health and eating healthy and exercising. So in the background, that was part of who I always was. And so I didn't really think of another career path. And so I was like, I'm going to become a doctor. And then when I had to choose, am I going to go to the clinical residency for a dietitian or for a physician, I shadowed a dietitian in the ICU. And I saw this 30-year-old male who had type 1 diabetes that was very poorly controlled. And the doctor was doing a bilateral amputation. A 30-year-old was losing his legs because of uncontrolled diabetes. And the doctor was like, did you take your medicine? And he was like, yeah, yes. And I go and I'm like talking to him, and he says, I said, what have you been eating? He goes, no one talked to me about diet. I just took my medicine. And something really was disconnected. The doctor said he was non-compliant, and no one wants to be non-compliant. That's not an answer. So that really struck a chord of, we're in our US, we're very into treatment. You have a disease, here's a pill, versus the cause of it. And so I decided to go into clinical nutrition because I wanted to prevent disease. I wanted to prevent, even if someone has disease, the complications and progression of disease, to give someone a good quality of life. And so I decided to do nutrition and use my platform to raise awareness about, we can change this. We can really, really reduce the risk of cardiovascular disease, its complications, and live long and healthy lives if we understand it better. And so I take a lot of pride in explaining to my clients what's going on underneath the surface, and why does nutrition play a role? Why do we need to eat certain foods in certain quantities to help with certain pathways to optimize in our body? And so I have a very big medical background, but I really look at the preventative arm through science-based nutrition and lifestyle medicine, because it is such powerful benefit And whenever someone is on a medication or being looked at from a treatment standpoint, if they don't pair nutrition alongside of it, the therapy is not going to work as effectively. And we have to recognize that. So I niched down into cardiovascular disease after my residency because everywhere I went to the weight loss clinic in my residency, the ICU, the kidney clinic, the liver clinic. Everyone was having heart disease, heart attacks and strokes and all these heart related complications. And I took a step back. I'm like, what's going on here? And then I saw the research shows heart disease is the number one killer globally, and in kidney disease and liver disease and all of these different components. And I was like, what is the missing link? What is going on? And I realized throughout my work is that people are looking at things in silos. Oh, you want to lose weight? Go on this diet. Oh, you want to, help your kidneys? Don't eat this. Like, but no one's connecting the whole dots. We are one person. We are one connection. We need to be looking at the whole picture. So I actually created my own cardiology fellowship within nutrition, and I worked alongside heart failure specialists, preventative cardiologists, electrophysiologists, different types of cardiologists. And that really honed into the vascular space. And so, really looking at your blood vessel health, your heart function, your heartbeat regularity, and making sure we're optimizing everything because they all matter. And so, I have a big passion for this because I've seen in my work the power of personalized science-based nutrition and how much years I've given back to people because they have ownership of their health.
Wow, that's yeah, really cool story and really inspiring. It really sounds like you found your sweet spot where you want to be and where you want to help people. I could also see that on your Instagram, for example, like you're really a voice for heart health and helping people prevent getting heart disease. Everyone who's listening, go check out your content on your Instagram as well, on your LinkedIn. There's some really cool stuff going on, and I think it's really great content to have in your rotation when you're on social media anyways. You might as well look at something that's positive for your heart health.
Thank you.
Since we are a men's health podcast, we do talk a lot about men's health, mental health, physical health, also like how important a sports routine is. We've had people who are running. We haven't had a single nutritionist here yet, or someone who's been talking about heart health. So that's a first. I'm also wondering what your relationship to mental health and maybe men's health is.
Yeah. So, there's a lot of buzz right now in the women's heart health space, but we know that heart disease is very prominent in men. We actually have most of our data and our research on men in terms of how we can reduce risk and who is at higher risk, because we used to have this saying that heart disease is a man's disease. Now we know it's both in men and women, so both matter. But we know the importance, and we've always known the importance of how we need to take care of heart health. I would want to make one comment though. You mentioned there's a lot of exercise people who came on your podcast, and I love exercise from many capacities. But what I've noticed, especially as men age, is that people think, well, I'm exercising, so who cares about my diet? Or they may say, I exercised out what I ate, so who cares? But I want to tell you that I have a lot of clients who are athletes. I have a lot of clients who've had heart attacks who are athletes. I have had individuals who are not overweight who've had heart attacks, and they are physically active. So please make sure that when you are looking at the whole picture, that you pair nutrition alongside your exercise regimen, because when you eat for your heart, you're taking care of many aspects, from better performance, better recovery, and also better mental health, because what we eat is a really impactful note on our mental well-being and on our mood. So a lot of times when we go into a restrictive diet or eat whatever we want, we neglect specific nutrients that are very important for our mental well-being and our mental health.
Well, yeah, I think a lot of people needed to hear that, especially the part on, well, I can eat whatever I want because I exercise. I know a lot of people like that.
Yeah, and I've seen it, trust me, I've seen NFL players who've had heart attacks and who've had aortic dilations and a lot of heart issues because they never thought about nutrition. They're like, look, I look like I'm healthy. I have muscles. Like, look at my body. It doesn't matter what I eat. We can't see the arteries in the inside. And we know if they're not taken care of, they will cause plaque to form and cause stiffness and cause a lot of complications. So don't stop the exercise, add in the nutrition. Your heart will thank you.
And can our listeners also reach out to you to work on their heart health directly?
Yeah.
Like what kind of things do you offer in this space?
Yeah, so I have group programs, I have one-on-one programs, and if anyone needs extra support, I'm more than happy to grab a phone call with you to see if we're a good fit. The one-on-one is a lot of personalization. So I take the science, I take your lifestyle, I create a health resource guide, a meal plan, and I help you implement change to optimize all your cardiometabolic health and your heart health. In the group setting, I teach you how to do that so that you can personalize it into your own lifestyle. And both have seen a lot of success. They really both can work. Sometimes people do hybrid models, but it depends on the way that you learn and the way that you implement change, because I want you to be successful. So the implementation is the most important key, and the consistency over the long haul. And that's really my goals with both of my programs. But you can check either one of them out at entirelynourished.com. You can always send me a note. I love hearing from you. So you can send me an email with any questions. And yeah, it'll be great for me to help support in any way I can.
We'll make sure to put the link in the episode description as well. Yeah, like I have one more question before we finish up.
Yeah.
And this is a question we ask all our guests on the podcast. And for us, it's also interesting to once in a while hear a woman's take on this question. So what does it mean for you to be a man?
To take ownership of your health.
Cool. Yeah, that's super clear. Yeah, so please do that, guys. Is there anything you wish for our listeners right now that like they might be listening to this on their commute to work while they're ironing their clothes, doing the laundry, cooking?
Order a blood pressure cuff and test that as soon as you get it. I want you to take an empowered approach so that you can live a long, healthy life without heart disease, so that you enjoy life. But you have to be proactive, and proactive means taking early action before something comes up in your health.
Wow. Thank you so much. That's it. That's been it for this episode. Thanks everyone for tuning in. Today we covered heart health and how you can live more healthy with Michelle. We'll be back. You can expect new episodes every second and fourth Tuesday of the month. Quick reminder again on how you can support the podcast. Follow us on our Instagram to stay updated on everything Hearts Wide Open, and subscribe to our show wherever you listen to podcasts, and leave a review if you like what we do. Thank you so much. I'll give you a virtual hug, and yeah, have a great afternoon, evening where you're at.
Yes, we're mid-afternoon. Yeah,
Yes.
thank you so much. It's been my pleasure to be here. I appreciate the time.